there. And thank you for joining us at Smart Student TV. Today, we discuss the anticipated surge in HIV/AIDS cases, especially in our institutions of higher learning, which are feared to become the next frontier HIV hotspot following the drastic Trump USAID policy shift. The developing world, just like other regions that heavily relied on USAID, is staring at an alarming HIV/AIDS health crisis. The most affected demographic in this crisis will be the youth population within institutions of higher learning. Colleges and universities, where freedom and experimentation are common, will turn into HIV hotspots. With the closure of VCT centers, lack of free condoms, and declining awareness programs, students will be left vulnerable to unchecked transmission of the virus. Furthermore, many young people, especially those already infected and who have depended on antiretroviral ARV drugs, will be at greater risk due to reduced access to medication. Without immediate action, the future of the youth and entire nations will be at stake. One of the biggest factors behind this looming crisis is the drastic policy shift by the Trump administration. In an attempt to cut funding for sexual and reproductive health programs worldwide, the U.S. government has reduced financial support for essential HIV/AIDS prevention measures. Many developing nations, which heavily rely on USAID for free distribution of condoms and contraceptives, will be hit hard by these changes. The lack of these resources will leave many young people unprotected, leading to a sharp increase in new infections. Additionally, restrictions on funding for HIV/AIDS treatment programs mean that fewer people living with the virus can access ARVs. This will result in weakened immunity and increased susceptibility to AIDS-related complications, further worsening the crisis. Voluntary counseling and testing, VCT centers, have long been a pillar in the fight against HIV/AIDS. These centers provide free HIV testing, counseling, and awareness campaigns that educate millions of young people about safe sex and disease prevention. However, with USAID funding cuts, many VCT centers will be forced to shut down or reduce their services. The closure of these centers means that fewer young people are getting tested, leading to more undiagnosed cases and increased risk of transmission. Furthermore, the lack of counseling services leaves many young people without the crucial guidance they need to make informed decisions about their sexual health. A recent assessment of multiple universities and colleges in Kenya paints a grim picture. In one particular university, previously funded by USAID under the PEPFAR program, there were fully equipped VCT centers, consistent condom distribution programs, and free ARV access for HIV-positive students. However, following the funding cuts, these services are feared to soon come to a sudden halt. A student leader at the institution, speaking under anonymity, described the unfolding crisis. "We are anticipating an increase in unprotected sex due to lack of free condoms. Many students who previously accessed ARVs for free shall henceforth struggle to afford medication. Some shall even stop taking their drugs altogether. New infections shall rise, and fear is setting in." Health officials and university administrators now warn that without alternative funding sources, many higher education institutions could become the next HIV hotspots, reversing years of progress in fighting the epidemic. The reasons behind this anticipated surge in HIV/AIDS cases among teenagers and young people include: 1. Lack of alternative HIV prevention measures. For years, condoms and contraceptives have played a major role in preventing the spread of HIV. Many of these have been provided for free by international organizations, especially USAID. However, due to recent funding cuts influenced by Trump administration policies, access to these vital tools will significantly decrease. This will mean more young people engaging in unprotected sex, unknowingly putting themselves at risk of infection. 2. Overdependence on ARVs and weakened immunity. For those already living with HIV, ARVs have been a life-saving treatment. However, many young people will soon struggle to access these drugs, leading to weakened immunity and increased susceptibility to AIDS and other deadly infections. This will make them more vulnerable, not only to HIV progression but also to opportunistic diseases like tuberculosis and pneumonia. 3. Ignorance and risky sexual behavior. Despite years of awareness campaigns, many young people continue to engage in risky sexual behavior. The belief that HIV/AIDS is no longer a major threat due to the availability of ARVs leads to recklessness. In many schools, discussions about safe sex and HIV prevention are still seen as taboo, leaving teenagers uninformed about the dangers they face. If this crisis is not addressed urgently, developing nations will face severe consequences. 1. More young people will die prematurely. With ARV shortages and weakened immunity, many HIV-positive youths will succumb to AIDS-related complications. This will mean losing bright minds who could have contributed to their country's development. 2. Learning institutions will become HIV hotspots. Without condoms and proper sex education, schools, colleges, and universities will become breeding grounds for new infections. What should be centers of learning will turn into centers of disease. 3. Overburdened healthcare system. Hospitals will be overwhelmed by the increasing number of HIV/AIDS patients, making it harder to provide adequate care. The cost of treating HIV-related infections will skyrocket, putting immense pressure on already strained healthcare systems. 4. Rise in teenage pregnancies and STIs. With limited access to contraceptives, more teenage girls will become pregnant, increasing school dropouts and economic hardships. Additionally, sexually transmitted infections, STIs, like syphilis and gonorrhea will also rise, further complicating the health crisis. 5. A generation at risk. The youth, who form the backbone of many developing nations' futures, will be at the highest risk. If this crisis continues, countries will be left with weak and unproductive workforces, ultimately affecting national development. To prevent this crisis from worsening, immediate action is needed at all levels of society. Here's what must be done. 1. Governments must step up. Governments must prioritize HIV/AIDS prevention programs. They should find alternative sources of condoms, contraceptives, and ARVs to replace the lost USAID funding. Sex education should also be made a mandatory part of school curriculums. Nonetheless, governments, NGOs, and local communities must work together to sustain the VCT centers. 3. Parents must take responsibility. Parents should have open and honest conversations with their children about safe sex and HIV prevention. Ignoring the issue will only make things worse. 4. Religious and community leaders must speak up. Churches, mosques, and community elders should play an active role in spreading awareness. The silence surrounding HIV/AIDS will only fuel its spread. The time to act is now. HIV/AIDS is not a thing of the past. It is still a deadly disease, and it is coming for the youth. The devastating impact of U.S. policy changes on healthcare systems cannot be ignored. If action is not taken fast, the developing world will soon face an irreversible health disaster. Share this message, spread awareness, and help to save a life.